Oh, is my camera on?
Hi, David. So nice of you to join us. I'm Ellen Teeter. I'm the Executive Director of FSOMA, the Florida State Oriental Medical Association, and David Bibby is our Legislative Chair. And he's agreed to take time out of his busy schedule to give us an overview of the legislation that we're pushing. And I'm going to then give you a little overview of how to get information on meeting your legislator, which is very important for us. David, thank you
Th-
for being here.
Thank you, Ellen. It's nice to be with
All right.
everybody. I wanted to just take a couple of minutes and revisit the idea that the state association, FSOMA, has been working for the last couple of years to respond to some of the questions that we had from leadership in the legislature about our Practice Act. And some of the questions revolved around scope of practice. Some of the questions revolved around things like professional use of titles, education requirements, things like this. And in order to put together a well thought out response to some of the questions that the leadership had, we took a hard look, and I say we, the state association leadership, our attorneys that represent the profession here in Florida for administrative law, and people that have been around the association for a long time in various leadership roles to sort of understand what's in the Practice Act, what needs to be updated to keep pace with changes that the Board of Acupuncture have created with our Practice Act over time. And the reason why those two things are important is that the scope of practice and the definitions and the Practice Act is established under 457. We're all familiar with that to some extent, I hope. That's the statute that governs practice of acupuncture in Florida. The Board of Acupuncture has a role to establish rules to either clarify or establish some more particulars in rule that is decision-making made by the board over time. It may be clarification on the definition of a term, for example, like the term acupuncture. You know, if you look at the definition for acupuncture in 457, there's a slightly expanded definition for what is acupuncture under rule. And the board has a role and responsibility to do that. And so over a period of years, they'll go back from time to time and extend things in rule to make practice clear for everybody. But one of the things, the reason why we're having this conversation is because despite the fact that we've had changes and improvements and updates to clarify things in rule, we have not really kept pace with making those same changes in statute so that the language in statute and in rule are equal. And the reason that's important is because anything that's established in the statute is the law in Florida, and it's ironclad in terms of establishing what is the scope of practice, what is the definition, what is a professional title, things like this. The board has a role in, like I say, creating rules to help define and establish and clarify things, but ultimately it is subject to interpretation under the statute. In other words, the rule is not a permanent law. It can be revoked by the Department of Health. It can be asked to be taken down or changed through other legislation. And so one of the things that we have to recognize is that the practice has grown quite a bit, both in terms of the number of licensed practitioners, but also the nature of the practice of acupuncture has evolved over the last 2 decades here in Florida in a way that has not kept pace with the statute itself. For example, the definition for acupuncture could be improved. There's no title definition. There's no other than acupuncturist under 457. And so we have permissions in rule that the board created for advertising, for example, to use terms like doctor of oriental medicine or acupuncture physician, things like this that don't exist in statute. And you know, although the board has a role and responsibility to do that, it can be challenged at any time by
Like 2 years ago, or last year, rather.
right,
Yeah,
precisely. And like we
yeah.
saw, and where leadership and other people who say, look, you know, we're looking at your statute and we don't see any definition for a professional title other than acupuncturist here. Or they'll look and they say, you know, we don't see any definition for what is the scope of practice for licensed acupuncturist. And if you look under any other licensed healthcare practice act, you will see a clear definition for what is the scope of practice for chiropractic medicine. What is the scope of practice for physical therapy? What is the scope of practice for practice of massage therapy? And because our Practice Act does not have a defined scope of practice, we're left with this loose group of definitions that just are a word here or there, like acupuncture, massage, tuina, electrostimulation, electroacupuncture, things like this, but they don't really have any definition. You have to look to rule to find those things. And it's a unique way to provide a scope of definition for a whole practice and profession of medicine. And so this is another area that we're asked to look at more closely and decide, what is the practice of acupuncture and Eastern medicine in Florida, and what acts and what things constitute that. And so basically what we can do is go into rule and kind of look at how the board has organized all the various areas of practice for us, but we have to take that, out of rule and into the statute so that things like diagnostic testing, and that includes use of clinical laboratories and imaging, that we exists in rule, but it does not exist in statute. And so, we have questions like that where you send a patient with an order to a radiology group to get an x-ray, and the radiologist says, I'm sorry, we don't take x-ray, orders from acupuncturists. And the reason is this, because it's not in statute, even though we have a rule that provides for use of imaging and clinical laboratory findings. It doesn't say clearly that you can order laboratory results, laboratory tests. So things that are part of our entry-level training, they're part of our continuing education, we're board tested on it, is things that are part of our entry level should be part of our scope of practice, and things that we are commonly need and use in practice with our patients every day. So those are just a couple of examples. I think acupuncture injection therapy could take up another 10 minutes of discussion on that, but the board's created acupoint injection in 2004 or 5, codified that in rule, but we don't have prescriptive rights in Chapter 457 for injectable solutions, and we don't have other permissions related to that in statute. And so
And we've run into trouble with pharmacies saying, sorry, can't sell this to you.
Kind of like what we were just saying about radiologists, because pharmacies, whether they're compounding pharmacies or other drug supply companies, they're regulated largely by the pharmacy board. And the pharmacy board requires them to do due diligence on, customers that call and ask for X, Y, and Z to be prescriptive products to be sold to them. They need to have prescriptive rights to those products. Right. And depending on the pharmacy, depending on the conditions, depending on a lot of things, it's a gray area of practice. And we want to make sure that, for people who are training, submitting themselves to the hours necessary for licensure, especially since now AIT is required for licensure in Florida, that there is no gray area of practice where you are somehow, disconnected from your ability to order, administer, use, inject, store, sell those products. You want to make sure that you have all of those privileges as part of your licensure. And so these are things that need to be kind of worked out with the Department of Health and with the legislature to just refine the language, expand the language where it needs to be more clear, to provide the statutory authority for the licensed practitioners to be doing these various things, like using professional titles, using diagnostic labs and imaging, using AIT. There's a handful of other things that that the profession would benefit from as well, but there are things we can discuss in more detail at a later time. But this is an ongoing process. There's probably about a dozen things that we want to look at updating within the Practice Act. And we may do, half of them this year and half of them next. We're just not always sure, how much of what we're asking to make these changes done can be done all at one time. Sometimes it has to be done incrementally. I think we're working very hard to make a really clear argument to the department that there's no real extensive grab here. We're not asking for all kinds of new things in our scope of practice that are not part of our existing training, that are not part of, the existing practice of acupuncture going back to the, early 2000s. And so all of this is, fairly normal things that are asking, and this is common for every healthcare practice, but I would also say for every regulated profession to have to circle back to the legislature, usually not every 20 years, but let's say every 5 to 7 years for some sort of statutory update, just to make sure that things are, codified in statute in the way that they need to be to make practice and business regulations very clear. So that's the
Right.
goal, and that's why we're doing this. I
Okay.
mean, we wouldn't necessarily be doing it if we weren't being challenged in certain ways, getting pushback, trying to reduce our scope or reduce our use of titles. It's sort of a natural response to those things. Plus, we're being asked by the DOH and the legislative leadership to be more clear, because they don't necessarily want to do something that is harmful to the profession, but they need to look into the statute and be able to substantiate and justify why it is that they're allowing certain things in our practice. And so if we've got gaps there, then, we're not covering ourselves the way that we need to.
Okay. So we're looking at title, we're looking at things that are commonly practiced that don't really have the statute behind them, and they need to have that to protect it.
Well, yeah, I mean, the risk is
So,
that somebody comes along and says, for example, that, ordering, diagnostic tests in clinical laboratories is the practice of medicine, and it's not considered the practice of acupuncture. And,
right.
and that's, I mean, it's a very simple one-line thing that, might be added into chapter 456, and all of a sudden, boom, use of diagnostic labs and imaging is gone. And the reason is that when the time comes and we have to have that conversation, we're able to point to the statute and say, not only is it protected in statute, but we have extensive training as part of our entry-level requirements for this. It's required by the state. And when we are able to sort of, balance those two things and have a cogent argument for why a change like that would be, it would be harmful to the profession.
Yeah. I just want to clarify what you're saying for myself. Chapter 456 is the practice of medicine, and they could put a sentence in there tomorrow that says lab imaging and laboratory tests and medical imaging are the practice of medicine, period. And that would exclude us because it's not in our statute from using them.
A couple things. I'd say 456 is the statute for general healthcare occupations. That's
okay.
The general.
Thank
Okay.
you.
And so sometimes they'll make changes there. 458 is the chapter for medicine. But when I say they make a change, they might make the change in 456 because it would apply to all professions. And under 457, we're not licensed to practice medicine. We're licensed to practice acupuncture and Eastern medicine.
Right.
And so if they say it's something other than the practice of acupuncture and Eastern medicine, or, then it's something that's outside of our scope. And so that's where you want to make sure that if and when something like that happens, that we have language to support what we're doing and why.
Okay. So the main thing is we're getting into the legislation to protect ourselves. And
I would say we're protecting ourselves for this generation of providers as well as future providers, because the profession is going to continue to evolve. And so there's some other sort of forward-leaning and forward-thinking changes that we want to make to the statute around continuing education, qualifications for licensure and training. There's some other things there too, things that will affect future generations of providers. And we want to make sure that it's good for us today and it's good for them tomorrow.
All right. Well, great, David. Thank you so much for taking time. If you want to jump off, you can, or you can stay.
I'd love to hear what you have to say. I'm going to stay with you.
All right. Well, it's just going to be some nuts and bolts. I've got a page to share for people watching. This is FSOMA. It says memberclicks.net, but you can use FSOMA.org. But put in /legislative campaign, it takes you to this page. You can also find it on the home page if you just go to FSOMA. I'm just going to put in FSOMA.org here so it shows up that way. It's the same page, it's just, and what you would do is click on Visit Your Legislator, and it'll take you to this page. So we've got make appointments. You want to download your how-to kit. and that'll open up actually in your computer. You can still download it if you wish, but it's how to find your representative, how to find your senator, general guidelines for a meeting, some great information there. The next thing you're going to be clicking on is a lobbying worksheet, and the Word version will download to your computer. The lobbying worksheet opens up on yours, and you can download it as a PDF, which is in Adobe. But this would be for you to make notes on your senator, your representative, look at what their committees are. You wouldn't need to necessarily worry about bill numbers right now. You also can make notes, Google your senator, Google your representative, find out what other things they're interested in. I know one of my first meetings with my representative, Jim Boyd, we compared notes about growing up in Florida and eating oranges off the tree. So, we made a connection, I feel like, and he would remember me the next time I would go to see him. So find something to connect you. You may not like their politics if you look at their webpage, but you can find ways to connect and have a conversation. Think of these as people you want to develop a friendship with. I like the phrase, they put their pants on one leg at a time, just like you. They're human beings. It's a little intimidating. I know the first time I started making political meetings, it was very helpful to have somebody with me. FSOMA will offer you that support. You let us know if you feel like you need that, and we'll find a way to do it. Let me finish a couple more things here. This is basically make appointment and talking point sheet, and it's really kind of step by step. Let you know it'll be about a 10 to 15 meeting in the local office. You don't have to go to Tallahassee. You'll call, you'll give them your name, you'll let them know you're a local business owner and acupuncture physician, and then ask them for an appointment. I would email and then follow up with a phone call. And if you're having trouble getting a response, let us know and we can help. The last thing you'd want to download is this handout. And this will be just information. You don't have to remember everything David was saying. That's for you to kind of know why it's important. But this is kind of why it might be of interest to the legislator. In 2023, 2024, we were asked to clarify definitions. We're increasing education requirements and safety standards. This is, you can go through this with them or just give it to them and say, this is what we're wanting to do. Please support our bill. If you have questions, contact Corinne Mixon. So it's basically the handout, one page, print it out, and hand it to them in the meeting. And then they can follow up with Corinne if they have questions. So we've got everything there. So that's number one. Number one is to download the kit, make the meeting. Number two is tell them about yourself and our profession. And number three is send a photo to us. Natty has a hashtag. You can ask me for it or ask Natalia at fsoma.org, and you can post it online, or you can email it, but they expect you to take a photo. And, it's important to meet with them and greet with them. There's going to be two kinds of meetings. We're developing a list of what legislators we might want to spend a little donation money on. And if people in that area, if I can find 4 or 5 APs to meet with them, we would meet the legislator at a coffee place, and give them some checks from the APs in the area and from FSOMA as a donation. Money doesn't get you everything you want, but it gets you their attention. And they take a little more notice of people that, feel strongly enough about something to donate some money. So that's one kind of meeting. Other districts that aren't maybe as crucial to our campaign, it's very important for you to go educate the legislators. When I was in Miami one time, the AMC, Acupuncture Massage College, had a speaker who was a state senator, and he admitted he did not know anything about acupuncture because nobody had bothered to tell him about it. There are legislators that know quite a bit, but there are many newer ones that have no idea who we are, what we do. So telling them what got you into it as a personal story, tell them about patients you've helped, educate them about what our medicine can do for the health of people in Florida. So if you have questions, director@fsoma.org, 1-800-578-4865. David, did you have
I
another
was going to say
comment?
that was an excellent presentation. Thank you, Ellen. All I wanted to say in conclusion to this is that, the most important component to influencing the legislature is just what Ellen's asking here and now. There's 2,500 plus or minus acupuncture physicians in the state. There's only 160 legislators, 120 in the House and 40 in the Senate. There's 160 people who in the entire state that make major decisions that impact your life, your livelihood, that of your patients as well, and our profession as a whole. And so with 2,500 providers and only 160 elected legislators, there's no reason why we can't get one person sat down with everybody to say, hey, look, put a face on acupuncture. I'm a licensed healthcare provider in your community. These are the types of things that we're doing. We're updating our Practice Act as we've been asked to do, and would like your support. Do you have any questions? That's it. And so that if we do this in the summer, we make these 10-minute connections so that come September, October, November, when the legislation is starting to move and they're trying to sort out the things they care about, and they're working with their staff on what they're going to vote yes or no on, they remember, hey, I met with Joanne. She came and sat in her office is down the street and around the corner from mine. We had a lot in common. She told me that they're updating the Practice Act, and here it is. And if they don't have any objections, they're going to vote yes. And so our role is to be a little bit more approachable, reaching out, making those connections, being a resource in the community for them and their staff. If they have any questions, they know who to call. And if we don't do this, the challenge is, no matter how good and no matter how important these things are to us as individual practitioners, to our practices, and to our patients, it's not going to be important to them in Tallahassee with all the clamor going on. We have to make an effort to sort of step out and say, hey, pay attention to this. It's coming around. If you see it in committee, please vote yes. If you have any questions, let me know. It doesn't have to be more complicated than that. And it's enough to create some of that momentum that in the fall, when we're back up doing legislative visits in Tallahassee, there's a light that goes off in their head. They remember they met somebody in their community. They talked to, a handful of people about these changes. It doesn't come as a surprise. And they give us a running chance, a little bit of momentum going into the committee sessions. So that's the most important thing we do, no matter how much money we raise, no matter how much noise we make. If we don't make a personal connection, we're just not going to succeed. And if we don't succeed, the profession is going to suffer because of that. This is an important thing to do now.
Okay, great.
Thanks.
All right. Well, let us know if you have questions. davidb.fsoma@gmail.com, director@fsoma.org. And did I say the right address for you, David?
Yeah, we got it right. And just anybody, if you feel like, you don't know where to get started, you listen to this, but, I want to make an appointment to go see my person. I don't know what to do. Call Ellen. Pick up the office, call the office, and she'll connect you with me or somebody else in your community, and we'll go make this happen. Okay.
All right. Thank you so much, David, and we will talk to you all soon. All right.
Thanks again.
Bye.